Pancreatitis by definition means inflammation of the pancreas. Broadly divided into two types, acute and chronic pancreatitis. One is digestion of the food, the carbohydrates, the proteins and fats in the food. And the second important thing is to keep the blood sugars in the normal range and to see you don't get diabetes by secreting insulin and some other hormones like glucagon. It also has a variety of other hormones and other functions, but these are the two major functions. Acute pancreatitis is a very dramatic disease with very sudden, severe upper abdominal pain, and the patient almost always needs to be admitted. And about 15 to 20% of such acute pancreatitis patients can go into the more severe forms where you have significant morbidity, fluid collections requiring drainage, and some die, lot of intensive care. By treating the acute pancreatitis cause, you prevent recurrences, that is making the patient give up alcohol and also removal of the gallbladder and taking care of gallstones. The three major problems with chronic pancreatitis, how it causes a problem to the patient and the physician and to healthcare, is chronic pain requiring narcotics and very bad situation, then the diabetes that happens because of this, and the diarrhea and fat in the stool because of maldigestion. Diabetes happens both in acute as well as chronic pancreatitis. In acute pancreatitis, in that 15-20% where you have severe forms, where there is a part of pancreatic tissue dies, what we call necrosis, obviously because of loss of pancreatic tissue, your capacity to secrete insulin has come down and you become a diabetic. But what is most important is that even in those patients with acute pancreatitis where there is no death of pancreatic tissue, and after they recover, 80% recover within few days, pancreas looks normal on a scan, but they develop diabetes. So something is happening to the cells secreting insulin even when there is no death of tissue. If diabetes already sets in, they can still, by doing the lifestyle changes that we emphasize in diabetes, good food, exercise, ideal body weight, etc., they can still probably avoid going on medications. But even if they have to go on medications, there is no substitute for lifestyle changes in any diabetes patient, pancreatitis related or not related.